This would be an indication perhaps that the subconscious memory survives longer, short-term and long-term memory survives longer in certain patients at subconscious level than it does in conscious level. It would be something that could be well worth trying out with Korsakoff patients.
Yeah.
It would be interesting.
It sounds like a patient like that would have very little to lose, so I would think that would be a good idea too. Have you all used it for age regression? Age regression? Has everybody used hypnosis for age regression? You know,
We'll be talking about that.
talk about that a little bit. I thought maybe I would tell you about our experience with the hemophiliacs, because a couple of you said you wouldn't be here anymore. You have something else, Bruce?
Yeah, one other thing, and we were talking about specialized populations, and within that, a lot of times we get calls from people who want to retrieve forgotten information, and usually it's because of trauma. And if it's physical trauma, the question is how much memory trace was laid down, how much is retrievable based on that. And a lot of times it isn't possible to be very positive about that. I think just because if the trauma has been significant and severe, there may be no memory trace to recapture. If it's something where there was no head trauma or there wasn't any generalized shock, it is quite possible to retrieve the traumatic memory. I got a phone call from somebody just before we left town, as a matter of fact, who was struck by lightning several years ago, and now is trying to recapture 5 days, and it happens to be somebody that we knew personally. And I was suggesting to him that it would be very difficult because of the magnitude of that trauma. I had some grave questions whether we could recapture anything of that at all, and I said to him, when I saw you in the hospital, that you were not in a very good place. And he said, that's just further proof. He had no recollection that we had been to visit him twice during those first few days. And he's struggling with that whole issue. It may come down to, if you want to try, we'll try, but it's hard to hold out a whole lot of hope for that. People who suffered psychic trauma, of course, are usually much more easily. It's usually easier for them to recall the information. But if there has been severe physical assault or chemical assault, people who were using alcohol or drugs, a lot of times the memory trace is impaired. And so when people call on the phone, I think you have to really be careful of trying to figure out how helpful you can be to them. You need to find out as much as you can about it. And of course, you never hold out any guarantees or promises.
Have you ever had cases, criminal cases, where someone has wanted to know if you could remember more details of criminals they've seen or incidents they've seen? Have you had people approach you with this question?
I can relate to a pretty interesting story along those lines. This?
No. He's fading as the afternoon wears on.
This is a lady who was called to the door of her home by the doorbell, and when she got to the door, a man shot her through the neck, and he almost killed her. She went into immediate shock. The background of the story, this happened in St. Louis. Her husband had been a contractor, and he'd gone bankrupt, and one of his subcontractors was very angry because he had gone bankrupt, and so he's the one who came to shoot her. Well, she went into immediate shock, virtually died. The man took off. She was transferred to Denver to a rehabilitation hospital that's quite famous for helping such people there. And while she was there, she decided that she wanted to know for sure who her assailant was. You know, in our country, you can't use this information in court. But this was a very nice lady who didn't want to say on the stand that she had been assaulted with this guy unless she really knew it. So in the state of hypnosis, she relived the night of this occurrence, and it was interesting to me. Her husband and her sister, who had been with her that night, were seated in the room, and she kept talking about things that happened closer and closer to the time when the doorbell rang. And the Johnny Carson show, one of our TV shows, she related things that were on the Johnny Carson show in great detail, things that her husband and her sister had forgotten all about, of course. And then she said, oh, there's the doorbell. She went to the door in her mind. She's seated in a wheelchair in my office. She went to the door in her mind, and there was silence. She didn't say a word. And I said, what's happening? She said, nothing. said, well, the doorbell rang, there must be someone there. With that, she said the man's name, came out of the trance state, and we went on with our work, and I realized she didn't come out in an excited or over exuberant state or anything. We went on, I realized a little further, brought her out of it. But the fact that she had recalled that he was the man who was at the door, then made her feel comfortable to go on the stand and say that, and that's what she did. Now, the police won't let you bring evidence directly in, because she would have to tell them how she learned of that. But it's a good indication of what can be done sometimes. Because that's kind of
That's what I meant.
right.
That's a pretty dramatic example.
Yeah.
In less dramatic form, we have had people recover like the last couple of digits of a license plate and that sort of thing. Again, it's not admissible in court, but once they can tell the police what they think they remember, it gives them a direction to follow if the rest of the evidence bears out. And
The direction might be false.
that's right.
Because if the number plate is close to one of a known criminal, that's the one that can go to.
Well, you know, they have to have corroborating evidence to use it.
In Holland, it's not a proof. And you can remember.
It's not approved.
It's not a proof.
No, it's
Well,
not,
it's
it's
not
not
proof
proof in
in
the United States.
All the police
either.
can
It
do is
can
take.
be a help, but it's not.
Right,
Yeah.
she's
That's the way-
clarifying that it can be a help, but it's not proof, and that's true in, I think, most courts around the world. I don't know, is anybody here from a place where they accept that as evidence?
We don't have legislation about that.
No legislation about it?
That's why it's frightening sometimes.
I think the thing that,
Why do you say it's frightening?
Because I know about a case, like a few cases where in the police they were trying to get hold of a number plate and they were pushing the person. Like we say, I will tell you figures from 10 to 1 and you will stop me when it is. And this is already pushing. And then they used the number plate that was quite close to that of a criminal they had on their list.
well, in the States, usually when we do that,
You can't ask leading questions.
you can't, and you usually have a tape recorder running the entire time, recording all parts of the conversation. And there are no leading questions at all. It's more like, tell me what you remember.
And that's all amateur work.
I'm sorry?
It's amateur work. Late work.
Oh, yes, legwork, right. Once they come up with a number, then it's up to the police to prove whether or not that was accurate. Sure.
I thought, as a last thing, we might briefly describe the work we've done with hemophiliacs. In the 2 or 3 of you who won't be here tomorrow. I can do that quickly, and then we can let people go home a tad early. Would that be admissible, advisable?
I couldn't understand what you just said.
Would you like to go home early?
No, I couldn't understand the first part. We're going to
I'm going to talk a little bit about the work we've done with hemophilia.
Yeah, I'm interested.
mit Bluter, mit Leuten, die Bluter haben. Hämophilie.
Okay. In 1968, we began. We took a pilot study. We had 12 people ranging in age from 2.5 years to 19 years. And I met with them for 3 months every week to see how they felt about having hemophilia. Hemophilia is a bleeding disease that is bequeathed to the boys in the family by their mothers who do not have the disease themselves. It's sex-linked, and therefore the boys catch it, whereas the mothers don't have it. As a result of that, the mothers who do give this to their male offspring feel very guilty and very overprotected. We had learned early in the game that anxiety makes bleeders bleed more. Whenever hospital visiting hours, when they had to confront relatives or friends, they would bleed more. If they're going to have a big exam at school, they would bleed more. A visit to grandma or any other unusual thing with which they were not accustomed to, experiencing daily. Anything that came out that seemed a little out of the ordinary would create enough anxiety that they often would have a bleeding problem. The bleeding problems are not just from cuts or injuries. In fact, most of them are spontaneous bleeds into joints, the elbows, the knees, the ankles, cardiacs in the old days had numbers, scores of bleeds into these joints. Now the joint is already full of fluid, so when a blood vessel pumps blood into the joint, it's overfilled and it's exquisitely painful. They have bleeds elsewhere in their body. They have the vessels in their heads rupture, they have strokes, they have splenic bleeds, gastric bleeds. In other words, anywhere in the body they can have a bleeding episode. And those bleeding episodes are traditionally counteracted by transfusion of whole blood, and more recently by transfusion of factors derived from whole blood. In the very complex clotting mechanism that, if you were to describe it chemically, you'd have chemical symbols all over one side of the room, but there are different factors that are essential for the clotting of blood. In hemophilia, factor 8 is missing. It's a congenital problem, it's a hereditary problem. They generally find out when they try to circumcise the male child that he has a bleeding disorder because his Ph.D. won't quit bleeding. They grow up then with this problem and knowing that whenever they're exposed to undue stress, they're going to have a bleed. They learn themselves to avoid that sometimes by little artifices of their own, but the fact remains. Our thought at the University of Colorado was to intervene and reduce their anxiety using hypnosis, and thereby maybe cut down the morbidity of the illness. So we had the pilot study that I mentioned. This went on for 18 months. The first few months were just getting acquainted with the boys, finding out how they felt when they were hemophiliacs, what it meant to be a bleeder from an educational, a social, a psychological point of view. We invited their parents to visit as well, and we really became well acquainted. At the end of that time, we started introducing them on a once-a-week basis in a group setting to hypnosis, and I taught them how to use hypnosis, again, as kind of a general tool. Then I acquainted them in the first place with the fact that if they could reduce their anxiety, and knowing that anxiety makes them bleed more, reducing it obviously ought to make them bleed less. But in this instance, we had a unique opportunity because for once we had a way we could measure the efficacy of a psychological technique. Namely, we could measure the amount of blood and blood products that the kids used. And this would then let us know how severe the problem was. So we measured it for a period of time before we started using it and for 10 months following. During that 10 months, we found that they used measurably less blood. In other words, they had fewer bleeds that had to be counteracted by transfusions. We had a statistician who told us that this looked like it was he ran it through a computer and said, this looks like it's a reasonable thing to pursue. The next thing we did was to divide another big group of bleeders into two groups. So we selected randomly from each group and set up a control group who got usual transfusion care at the University of Colorado, and then our hypnosis group who got the same care, but they got hypnosis as well. The hypnosis group met on a weekly basis. Again, when they were hospitalized because of a bleed, we went to their room in the hospital, did our trance thing there, so we didn't let anybody miss a meeting. If someone was sequestered at home, we included him on the telephone. We did that for 10 months, and at the end of that time, the statistician said, this is out of this world, you are having a fantastic result. However, it's probably a Hawthorne effect. You are all familiar with it, I'm sure. It's where people react to the novelty of the experiment, and they're trying very hard to please the experimenters as well as themselves. And so you have to do it for a while longer. So we prolonged it then for 10 weeks, 20 weeks, and 30 weeks further. At the end of 40 weeks, we found that we did indeed have a statistically significant result. Namely, that the hemophiliacs using hypnosis had a markedly reduced rate of transfusion. In other words, they had fewer bleeds, they were in the hospital much less often, and they had fewer transfusions, which was our measurable quantity. Since then, it's been propagated and used extensively in other medical centers, not just in our country. In 1975, I have a question.
If you have information like that, where you have very clear measurements, you make very clear measurements, which should be able to impress the medical world very easily. Don't you feel very suppressed or depressed if doctors don't positively react to a method like this where you can prove?
Well, a lot of doctors do act pretty positively. We've had a reasonable reception in many places. You're right, though, it could be well accepted more places, but, you know, it's not a hematological thing, and the hematologists are real doctors who often don't put a lot of confidence in shrinks and in psychological procedures. Since then, though, we have propagated, it's been picked up in other countries. We've had a doctor from Brazil that came up. They can't afford to use ordinary treatment in Brazil because they can't afford the blood to transfuse one hemophagot, let alone the numbers they have. So they observed our camp, have taken it back there, and we have had, as I said, overtures from other places. We've had, Janine suggested that one thing we might do would be to teach them in Colorado from other places. So we started a summer camp where we had leaders come from all over our country to Breckenridge, Colorado, where we have a winter place, where we have an office there as well. We had the first camp there in 1975, and it was a foolhardy venture on our part because we had just the two of us and the two people running the Hemophilia Foundation, and we tried to take care of 8 bleeders at a time. We were transfusing bleeders at our kitchen table in the middle of the night. It was the damnedest thing I ever saw. We had the bleeders all wanted to stay in up tents outside of our house, so we let them do that. We had 8 inches of snow. The next morning they were lined up inside wall-to-wall bleeders. We had one kid who was...
There's several people's questions.
Yes,
Okay.
could you tell a little bit more about the setting? How did you do it? You say you did it for several months, but how often a week? How long a day? I don't know what you exactly mean when you say you introduce it.
We met once a week at the University of Colorado. They have a psychiatric auditorium there. And we met in that auditorium because that was a place where we could get a few people in. We had the parents often sat behind the children. The bleeders sat on the front row. And we went through the technique twice, just as I've mentioned that we often do in our clinical sessions for anything else. We discussed their experience between visits, and then what experience they had in the bleeding during the trained state, and they did it a second time. And then, of course, we encouraged them to do it by themselves because we wanted them all to learn to use self-induced hypnosis, which they did. Did that clarify it for you?
A lot of times then too, the families, some of these were older hemophiliacs who were married, their spouses would also sit there, or the parents. And since these are very anxious relatives, they often got quite a good benefit too. And of course, the calmer that the parents became, the calmer the child became. So that was a real payoff in terms of doing it in that sort of setting and using the group modality in that way.
You teach them hypnosis. Do you direct their attention to bleeding, and do you say anything about healing?
No, not necessary, because, well, at least we found it was not necessary. There's another child psychiatrist named Buxton, who is at the University of New Jersey, has since then done a study on the clotting mechanism and found that people with anxiety do not clot as well in general because it affects the platelets. So what we probably are doing, we aren't affecting the factor VIII, but we're affecting another significant part of the clotting mechanism that lets them bleed less. And of course, that's what we did. But it's not necessary to say, all right, if you do this, you're going to either shrink your vessels, etc. Since this whole mechanism goes on in the mind of the patient, that's what hypnosis is. It's a phenomenon already going on in a mind that is fully informed. You don't have to gild the lily and say, you're doing this because. They know why they're doing it, and they know what benefit they might have from it. Now, how those words are translated into the action that's necessary to create this, we don't know, as in anything else that's achieved with hypnosis, but the change is readily apparent.
In other words, just getting into the state decreases the bleed.
Yeah.
You don't need to tell them to try to contract their vessels if they have a bleed or anything. The only thing that we really specifically put into the trans with bleeders, and this is as sort of an apology to the hematologists, is we always put in the suggestion that they will stay alert to any problem with their basic bleeding disorder and seek appropriate medical care immediately. Because that's one of the fears that hematologists had. They said, well, if you get them so relaxed and they're not feeling the pain, they're going to ignore this. We know that that's not true because we know that in the altered state or the hypnotic state, that they're conscious and they're free to react, to be aware of what's happening in their body. So we knew that they wouldn't, but because the hematologists were afraid that they would be neglectful, we put in that little phrase, and so we say that.
It gives them some control when you say you can control your bleeding.
Right, and I think that's
one
the
reason
reason.
why it works, because not only do they demonstrate that, but this is the first time they've been able to use anything to help themselves. They've always been pawns of the blood banks, the hospital, first of all, their parents, and so they always felt like they could do nothing to help themselves. So letting them have something they could do, they were doing it 10 or 12 times a day, a lot of it, which is far more than would probably be needed. The altered state wears off maybe 3 or 4 hours. These physiological signs and symptoms that we're talking about here today wane gradually over a period of, say, 3 or 4 hours. Then the person feels a little uptight again, they can do it again. Well, these kids would do it every 2 hours maybe, because they wanted to be sure that they kept their anxiety low. And so they did it like it was going out of style just because they finally had something they could do.
And when they are in the altered state, let you dream them, or what are the suggestions you give?
You don't need to give specific suggestions.
You say
Except
just relax and
you're relaxed, your anxiety is low. It's a biochemical problem that we're dealing with. So they aren't sophisticated to know what that is anyway. They don't know anything about platelets and the various things that seem to work. So, all we have to do is tell them if they reduce their anxiety, they'll reduce their bleeds. And of course, once they've done that, they demonstrate to themselves, then they know it works.
And we often say, you can feel really good about this. This is the way that you are in control. You can take more control of your life. The more you do this, the less severe, less frequent your bleeds will be, but nothing specific. I know some people use imagery like imagine there's a faucet and you're turning it off and off and off and off and off. If kids want to do that, there's no contraindication to it. It's just that for a lot of people, it feels sort of strange, and so we just tell people they can do it however they want to, and we don't put that kind of suggestion in.
It's pretty mechanistic. What happens if the faucet won't turn on? You've introduced an unnecessary possible problem. Another question.
Do we have made a specific preparation for surgery for these patients?
I'm sorry?
Do we have made a specific preparation for surgery?
Specific preparations for surgery.
Yeah.
And what kind of suggestions do you
I don't know of any hemophiliacs that have had surgery with hypnosis only, but they do have.
I mean, as preparation to hinder that the bleeding is too strong during surgery.
Yeah, we just
Pre-operative, not intraoperative.
Right. Well, you can use it pre and post, and in fact, some of them have rallied and done pretty well. But they do fortify them, as I'm sure you know, with additional factor 8. They pump them up so they won't have surgical complications. But just the equanimity they can gain from hypnosis helps them a great deal in the healing process.
None of the hematologists are really willing to take the risk of not transfusing ahead of time. And so, I'm not sure that I want to put my life on the line for that either. I have recently, though, had experience with somebody who was not a bleeder, but she was having foot surgery and wanted to use hypnosis rather than general anesthesia. She was going to have a local, but she also was going to use hypnosis, and her surgeon agreed to do that, but was saying that he was worried because of the amount of blood that's in the foot, and that he would be worried if he had to do too much manipulation to get the procedure done because of the